Hello, this is John Kanellopoulos from our center here in Athens, Greece, the LaserVision Ambulatory Surgery Center, Clinical Professor of Ophthalmology at NYU Medical School, New York City, New York. We're already within a SMILEPro procedure with the Visumax 800. This really fascinating technology. We're seeing here the applanation. We have the Purkinje image from the green blinking light. The laser has started. It's under 8 seconds to create first what we saw here, the lenticular flow through the cornea, and now the top lamellar dissection plane, and that's it. I mean, the change between the 800 and the previous one, the 500 Visumax, is drastic. The technique remains the same. We're going in here with a blunt spatula to create the space over the lenticule and now under the lenticule. And with the olive tip forceps, we have to separate the space over the lenticule carefully all the way out. And now we're sliding under the lenticule. You do not want to do these reversely because it would be very difficult to separate them. So here we're finding a little bit of difficulty, and I chose this case to show you probably the minor intricacies of SMILE. You want to make sure that you're under the lenticule, as you can see here, better defined. Again, back with my olive tip. Patient did not have blackout during the femto work. Carefully now. It's very important not to significantly manipulate the cornea because this will delay healing. Trying to separate the lenticule from both sides, thus to be able to complete the separation and be left with a free lenticule, which is folding onto itself here, brought to the SMILE incision and pulled out with a blunt forceps. And we're essentially done. The beauty of the procedure is that there's really no significant precautions that need to be taken with this procedure. It's essentially done. We'll just rinse to make sure there's no epithelial cells or any debris introduced into the SMILE pocket. Antibiotic, corticosteroid drops. The vision recovery is drastically faster. Most of these patients surpass 20/20 within the first hours of the procedure. So it's become very comparable to LASIK. Antibiotic and corticosteroid drops here, and an impeccable procedure. You can see the patient is comfortable, very little movement during the procedure, and we are under 3 minutes with the first right eye. We're going to left eye to look a little bit more into detail. You can see the images, the two cameras that show us the patient interface applanating the cornea on the left side. Very important to focus on the Purkinje image on the vertex. What you don't see here is during the applanation, there is a reticule that guides you to the vertex. Procedure is completed as far as the femto is concerned, and it's really impressive. Both passes, the lenticular, the more deeper pass in the cornea stroma, and the lamellar non-refractive pass that's superior to that, take in essence 8 seconds. There's no blackout for the patient. The patient keeps seeing the green blinking light. Very good stability with the suction system. And again, same steps here. We first created the two planes, superficial and deep. We're going in with the olive tip cannula here, or spatula rather, to separate the superior first cleavage, and then go under the lenticular pass, trying to balance out left and right the freedom of the lenticule, and occasionally some tags that within the first cases you can sense and bypass as a learning curve. If not able to do with just one hand, we can grasp like here, and again chose this as the highest level of difficulty in quotes. I'm holding the lenticule with one hand and freeing it with the olive tip spatula. Again, rinsing, removing the fluid, and we're done. Two perfect procedures, 2016 within the first day, -4 myo. Thanks so much for watching. This is John Kanellopoulos signing out.